Hello, everyone. Thank you for joining me at my webinar on Clench, my 5-step process to a pain-free jaw. So this is going to be a great webinar for you if you have seen a chiropractor, massage therapist, another physical therapist, if you've been working with a dentist or any other provider for your jaw pain and you just haven't really seen the results that you are looking for. So the purpose of this webinar is firstly to let you know that you are not broken. Sometimes our bodies just go into this chronic fight or flight position and we can't get out of it, especially in today's society. We are always on to the next thing. So stress is going to be something that we're all dealing with pretty much throughout the day. And it's causing almost an epidemic of clenching and grinding, not just during the day, but mainly at night. Most of us have no idea that we are clenching and grinding at night until a dentist tells us because our teeth are being worn. And this is because we are in this stress epidemic, constant fight or flight instead of rest and digest. So this webinar is going to be really great to show you some new tools and techniques that are available to you instead of spending $7,000 on this TMJ protocol and stimulators that maybe your dentist is trying to push on you. You don't need another Botox injection. You don't need another steroid injection. We need to find tools that give us long-term results and a process that will give us long-term results instead of these short-term expensive Band-Aid fixes, which really at the end of the day aren't fixes for the problem. So I want you guys to understand that your body is resilient and it is always trying to heal itself when we give it the right tools. You have the power to overcome this hurdle. I know if you're probably watching this webinar, you might be at the point where maybe that's kind of hard to believe, especially if you've tried so many things. But the purpose of this webinar is going to show you what my 5-step process is for addressing and treating chronic TMJ pain, temporal mandibular joint disorder, dysfunction, and headaches, migraines. If that's also an issue for you, it's kind of a similar process. So you are in the right place, and thank you for joining me. Going off of that comment, our body is always trying to heal itself. I posted this image of treatments or no treatments in those with chronic TMJ dysfunction. So you can see that this study by Curita, if you want to read it, there's the little link. But those who had no treatment, 43% of those people, I believe it was over the course of 2 years of prolonged symptoms. Once the 2-year mark basically hit, 43% of the participants were symptom-free. That means they were pain-free. And then 33% were improved, which basically means, what is that, 76% of people who experience TMJD, jaw pain, will experience some type of resolution without treatment. Now, this is not desirable, right? We don't want to have pain for 1 to 2 years. We want to get relief sooner. And there is a way to do that by addressing the root cause. The point of showing this section is to show you that even if you're getting kind of thrown around from provider to provider, there is hope. Even if the root cause doesn't get found, the body really is always trying to heal itself. And the reason this happened is because there's retrodiscal tissue. So the disc is like a meniscus that sits in the jaw joint. If it slides forward and it gets anteriorly displaced, which I'm sure if you guys have found this webinar, you've heard of anterior disc displacement. If it gets stuck and it doesn't go back, the tissue that's getting painful and inflamed and causing you pain eventually scars and becomes, they call it a pseudodisc. So you basically form a new disc, which is pretty freaking cool, I think. Though the pain for that amount of time is not desirable. So the idea is to address the root cause of your pain so that you don't have to, have no treatment for 1 to 2 years. We can get you feeling better sooner. But this study is just to show you that you're not a lost cause. There is hope. Now, let's go over the causes of jaw pain. Why might you have jaw pain? Well, you can have disc displacement without reduction. That means the little disc that sits in the condyle of the jaw, the meniscus, slides out of place. It's not doing a good job of absorbing forces and shock. It's out of place and it doesn't move back. Without reduction just means it does not go back. That can cause pain. If you have a history of jaw dislocation, that's pretty obvious. There's going to be some pain. There's going to be some tissue damage from the joint forcibly coming out of place. That's understandable. Muscle tension. You might have some muscle tension if you clench and grind and your jaw muscles are chronically tight. We usually see that in the masseter and the temporalis being the main causes. But there's also the lateral pterygoid, which is going to be like right in the soft tissue under the zygomatic arch or inside the mouth. Clenching and grinding. Many of us are clenching and grinding and we don't know it because it's happening at night. Now, if you know you're clenching and grinding in the daytime, that's something that can be more easily remedied because it's a habit change compared to if we're doing it at night. What are we supposed to do when we're in our subconscious, right? So clenching and grinding is definitely another obvious cause of jaw pain. And your dentist may tell you that you're a clencher or a grinder upon examining your teeth. Other causes that are often overlooked to your jaw pain: poor posture. So lots of us are getting tech neck. We're all sitting at laptops, looking at our phones. All of our work is done in front of us. So if our hands are in front, that causes our shoulder blades to come more out and away from sitting up at the back where it should be. They're kind of more out. We get rounded shoulders. Our head comes forward. And if we have forward head, that places extra stress on our jaws. Now, other causes are mouth breathing or open mouth posture. So if you are resting with your mouth open and your lips are not touching, their mouth is not closed, and you are not breathing through your nose, that strains your jaw over time. That is not a good posture for your jaw. Another cause that is starting to get more notice and attention, thanks to, I think, the internet, are tongue ties or restricted movement in the fascia connecting your tongue to the floor of your mouth. And this can cause compensatory movements at the jaw. So I'm a good example of this. I had a tongue tie my whole life. It was restricting movement of my tongue. And so if I wanted to clean my mouth and get pocketed food from inside my back molars, my tongue could not reach over the molars and get to the food because it was tied. The fascia was too restricted. It was tied down. So I would use my jaw to, I don't know if you guys can see that. My jaw would carry the tongue over, and I was essentially minorly dislocating my jaw out of the joint each time I chewed. And over time, that's going to cause muscle tension. So here are some images of what we just talked about. Why would you have jaw pain? So let's look at this lady here. This lady has hard, typical Western lifestyle posture. She is leaning forward. You could see her elbows and hands are forward. That's causing her shoulder blades to come further out towards the outer parts of her back. That strains the back muscles because they're not being used. And her head is forward, and she's also looking up. So that is really placing an undesirable amount of tension on her head, neck, and jaw joint. And on the image in the top right corner here, we have someone who is mouth breathing. So that is open mouth posture, mouth breathing. Over time, that is going to cause issues. And it's also a sign of a myofunctional disorder. Why are we breathing through our mouth? Can we not breathe through our nose? Is the tongue sitting in the floor of the mouth and blocking the airway? You can try, if you're not really a mouth breather, you can still try letting your tongue sink into the floor of your mouth and try to breathe through your nose. And you'll find that you can't breathe through your nose if your tongue is in the bottom of your mouth. So the only way you can breathe if your tongue is resting there is by opening the mouth and breathing through it. And now in the bottom left corner, we have anger. I searched anger, but it's not, oh, you're angry all the time. It's really just showing the posture of stress. Anger is another form of stress. So if people are making you mad at work, yeah, you're going to be stressed. People are making you mad while you're driving, you've got road rage. But if you're just stressed about anything, especially women, we tend to hold all of our stress up in the upper traps, those bringing our shoulders to our ears. That is not really what we want. That tensions the shoulders, it tensions the neck. And you can see she's clenching. So another just chronic form of tensing your muscles and your body all the time. And in this bottom right corner, we have stress. So another image of stress. We've got shoulders are up, chronically overthinking. But in this image, it's not really the posture that I care about, like in the one on the bottom left. It's more of if our thoughts always running around, this is where we tend to get people who are clenching and grinding at night, fracturing our teeth because we have a big exam coming up, like a licensure exam. Someone's getting a divorce, just really stressful life events that can cause stress in forms of sadness, overthinking, perseveration, rumination. That's where it's going to get you maybe clenching in the daytime, but maybe not so much as the one on the left, the bottom left. This is going to be more of at night, clenching, grinding, and bruxism. So, what are my 5 steps to achieving a pain-free jaw in my patients? So, step 1, we want to relieve tension and pain. That's going to be through techniques like massage, dry needling, just getting the tissue to calm down and let go. That's kind of low-hanging fruit. We can get that going in the first few visits. Then we want to start introducing exercises to properly activate the muscles and stabilize the joints of the jaw, the joints of the neck, even the joints of the thoracic and lumbar spine. The whole spine up to the jaw, we want stability and proper muscle activation. That's going to help prevent the pain from coming back. In addition to retraining movement, activation, and behavior patterns of the jaw, neck, diaphragm, and the remainder of the spine. So essentially, that's neuromuscular re-education. We're going to start getting your patterns more automatic the way we want them to be. We're going to optimize those patterns so that you maintain them once you discharge. Step 4 is kind of tied into all of this. It's not really a 1, 2, 3, 4, 5. They blend in with each other, right? So step 4 might be blended with 2 and 3. But we're going to improve body posture because, again, jaw pain is so tied into posture, and posture is tied into breathing. So we want to make sure that we're addressing opening up the tissues of the front of the body, strengthening the tissues of the back of the body, just to balance your posture properly. And then step 5 is, if needed, I would say 50, 60% of people who come to me with jaw pain do need this myofunctional therapy component, but not everyone will need it as in depth as others, right? So some people may have a tongue tie, some people may not, some people may need a release, a lot of people won't. It's very nuanced, but step 5 is going to be retraining coordination and habits. Again, those neuromuscular patterns of the lips, tongue, airway, and jaw with oral myofunctional therapy. So here's step 1. These are just some images of what we do. We're going to relieve tissue with soft tissue work. So temporalis up here at the sides of the head, masseter right here down at the cheek and the jawline. Do some intraoral release. So putting on a glove, releasing the floor of the mouth, the lateral pterygoids, which are just inside the mouth at the jaw joint. Maybe even the muscles in the back of the head, the upper traps. Dry needling is really great for that. That's the image on the right. That is actually one of my colleagues, Lauren. She was suffering from some jaw pain. So we hit a few points. You can see the needles are all around the jaw and in the muscles surrounding the jaw. So I find dry needling, if you're not afraid of needles and you could tolerate it, to be extremely effective in achieving the process of pain relief in step 1. Step 2, We want to stabilize the joints. So I have a picture of a lady opening her mouth as wide as she can, right? And you can see that the line between the front teeth and the bottom teeth, it looks pretty symmetrical. It looks like that's a straight line. There's no like weird tracking this way or weird tracking this way. Like her jaw joint hasn't come off the track by any means. But if you did an opening test at the mirror and you see that your jaw is deviating to a side when you open or curving and deviating to a side when you close it, that means that we need to address the stability of the joint. So we can achieve that with some gentle isometric exercises at the jaw and the neck. And then we'll progress to ranges that you can tolerate with some resistance until we're at a wider range with manual resistance. And we'll perform this in various positions so that you can adapt your pattern the way it needs to be for when we're upright and doing things like chewing, talking, really anything that we need to use our jaw for when we're upright. And then step 3, training our neuromuscular system. So you're going to see that at first, maybe some of the things that I ask you to do are tricky and difficult, and it requires you to look in a mirror and cue yourself or put your hands on your jaw joint and feel what's going on. It's going to be very much like, how do I do this? What am I doing? And that's kind of, I put pictures of the roads to illustrate that. So this dirt road is where we're starting, right? It's like this, we've cleared out the trees, we're building a pathway, hasn't been traveled very much. It's going to feel awkward and clunky, like riding on a dirt road at first. But the more you improve your ability to isolate and dissociate certain muscles with movement, and the more you practice, because it's neuromuscular reeducation, you're going to form a beautiful paved highway, nice high-speed highway. You can see there's cars driving down fast. You got the lights going. And that's the automatic pattern that you're going to see. So maybe at first, when we're doing some jaw isolation with the tongue, it's really difficult, but each day it gets better. The more you practice, you get it until it's automatic when you're doing something like chewing. Because frankly, when we're doing an automatic movement, you shouldn't have to think about it. But you do have to think about it and practice a lot in order to get to that desired automatic pattern. Now, improving posture. So sadly, my screen is blocking the woman with the ideal posture, but I'm okay with that because I want you to see the undesirable posture here. Most of us don't look this bad, but we're all kind of in the realm of it. We're all a little rounded, our heads forward. We're looking at phones and computers all the time. We're not working our posterior chain. So all of the muscles, the back of the head, neck, thoracic spine, the back, gets really neglected and we just lose balance. So we're all kind of existing in the plane of this woman's posture. And I put an image of a bowling ball because our head weighs about the same as a bowling ball, 10 to 12 pounds. Now, I want you guys to understand that for every 1 inch the head is forward, you're adding 10 pounds of pressure on your head and neck. So you're not going to necessarily feel that, but it does place on the ligaments and the tendons and your discs. And over time, it's really straining for that part of the body. So understand that once your head is tilted 15 degrees forward, that's now 27 pounds of force at the head and neck. And then 30 degrees forward is now 40 pounds. 45 degrees forward, 49 pounds. And once we're at like 60 degrees, and I don't know if that's 60 guys, but I'm being dramatic. We're at 60 pounds. And that's just pulling down on your neck and your thoracic spine, and it will cause pain. This is really tensioning your jaw. And I want to show you that here. So another continuation of improving posture. Forward head leads to your jaw automatically retracting. So coming backwards. So you're forward and then your jaw goes back to try and balance where everything is, especially if you're going to chew, the jaw still needs to function even if you have a forward head. So your jaw is going to automatically retract. It's not going to be held in a neutral, desirable position. And then all of a sudden, we're compressing the retrodiscal tissue, which we talked about earlier. So see this image where it's zoomed in? We can see that the disc is not in its proper position. The disc should be sitting right in between the arch and the condyle, and it has slid out of place. And now we are getting this chronic inflammation at the joint. And that is where your pain is coming from. So, step 5 is going to be retraining our breathing, tongue, and jaw pattern with myofunctional therapy. So, as I said before, this may or may not apply to your plan of care if we work together, but chances are it will. We need to focus on the root cause of why you have jaw pain. And a lot of times it can be linked to tight tissue in the floor of the mouth, the neck, the jaw. It can be connected to dysfunctional patterns with breathing. The tongue might be lazy and blocking the airway when you're sleeping. So we look at snoring, we look at sleep apnea, we look at habitual breathing patterns, we look at motor control of the tongue and the mouth and the lips. All of this is tied in. Myofunctional therapy also addresses posture. It's very focused on an interdisciplinary approach. So a speech language pathologist may be involved. A dental hygienist may be involved. Physical therapist, orthodontist, ear, nose, and throat doctor, ENT, pediatrician. Now, my practice is not based in pediatrics. I am focused on adults. So I don't think I would work with anyone under the age of 12 or 14. I think that depends, but you see this a lot. A lot of children are getting myofunctional therapy because it gets caught earlier. And I think a lot of mommy groups are kind of on it with talking about tongue ties and these issues. And moms really talk. So the pediatric realm is getting a lot more attention than the adult realm, because I think people also assume that if there was a problem, it would have been caught in childhood. And that's sadly just not the case anymore. So to tie this all together, if you're tired of short-term relief, maybe it's from adjustments, massage, Botox injections, steroid injections, or just spending thousands of dollars to not get any type of relief, my practice really focuses on addressing the root cause of your jaw pain. Why is this happening? Let's take a look under the hood and make sure everything is functioning properly so that we can get long-term results. So I'm going to suggest, if any of this resonated with you, booking a one-on-one TMJ or myofunctional consultation at one of my locations in Northern Palm Beach County. I will also offer telehealth for any resident of Florida because that is where I'm licensed. I am not licensed in other states, so I cannot offer telehealth if you are outside of Florida. But I would encourage you, if you are outside of Florida, to look for a physical therapist who specifically specializes in TMJ pain, as well as a myofunctional therapist. I'm going to put the online booking link as well as a link to my website and email in the description of this video. And if you have any questions, feel free to shoot me an email. And I do have free resources, more free resources on my website. If you're still unsure, shopping around, and maybe just need a little bit more time. The takeaway from all of this, again, like I just want to go back to the first slide, is that you're not broken. The body is resilient and always trying to heal itself, especially if we give it the right tools. And again, I really want to reiterate that you have the power to overcome this hurdle. So thank you so much for joining me. And if you ever need anything, I'm here for you. Welcome to non-traditional physical therapy.